Hello everyone, my name is Maria Karlsson and this is my presentation on oppositional defiant disorder for GE502 at St. Peter's University. Throughout this presentation, I will not be making verbal references to all my sources, but you will be able to find them on the slides. To start us off, I would like to show a clip with Dr. Kimberly Williams. She's a clinical psychologist, and she's going to define oppositional defiant disorder for us.
Oppositional defiant disorder, or as some people know as ODD, occurs in about 20% of the school-age population and is definitely more commonly seen in boys than girls. Children with ODD usually are diagnosed by the age of 8 years old, and it's a consistent pattern of defying authority, being vengeful, seeking revenge, not following rules, and getting into trouble all of the time. I often consider that children who have these signs and symptoms of ODD, it's really secondary to a bigger problem: anxiety, depression, some type of school-related difficulty. When I see this pattern of behaviors and when it may be discussed with different parents, we're often looking for other underlying causes of the ODD. Because it is a series of negative behaviors, ODD can be treated with behavioral therapies and behavioral management. It's important for the parents to seek professional help so that they can learn some of the key factors to help manage the behavior. So while there are many other factors to consider with a child who's oppositional, these are some of the key points that parents should understand and recognize to help their children.
So just to recap what Dr. Kimberly was talking about, so oppositional defiant disorder, or ODD, it is a disorder where the child shows the following behavior for a period of more than 6 months, and this is for children older than 5, which is what we're focusing on. They show frequent and persistent pattern of irritability, anger, and loss of temper. They can also be argumentative and show defiance towards authority, such as parents or teachers. They can also show signs of vindictiveness. So there are different levels of ODD that occur in the primary settings for children, home, school, or with other peers. And you have mild, where it occurs only in one setting; moderate, where it occurs in at least 2 settings; and then you have severe, where it occurs in 3 or more settings. And one of the things that I've noticed as a volunteer is one of the cases that I was working on, the child was acting out terribly at school and were having complete meltdowns, authority issues, etc. And then when the child came home, there were absolutely no issues at all. So the mom was mystified by this behavior. So she was diagnosed with a mild grade of ODD. So what are the risk and contributing factors to ODD? Temperament, difficulty regulating emotions and getting easily frustrated. Insufficient parenting, such as abuse, neglect, or lack of supervision mixed in with harsh or inconsistent discipline. Other family issues, such as mental health or substance use, can impact it. And then there's also contributing factors, such as genetics, possible neurobiological differences in the nerve and the brain function. And I found a doctor that works at Harvard University that took a look at this and explains it pretty well. So let's take a look at his interview here.
The interaction between genetics and experience that shapes brain architecture is embedded in the reciprocal relationships that children have with adults in their lives. And by that we mean what we refer to as the serve and return nature of children's interaction with their adults. Development and the impact of experience on development is not a one-way street. It's a back and forth interaction. The brain is a highly integrated organ which has multiple sections that specialize in different processes. So we have parts of the brain that are involved more in cognitive function and other parts that are involved in processing of emotion and parts involved in seeing and hearing. So if a child is emotionally kind of well put together and socially competent, that will affect more positive and productive learning.
So Dr. Schonkoff showed us there how your family life, your parents can impact actually your brain function. If you're getting positive reinforcement and recognition from your mother, for example, that can actually help impact your learning. So what is the role of the family? So for ODD patients, so family life is the strongest known predictor for ODD. Dysfunction, overreactivity, and a lack of warmth can increase the risk of ODD. Parental depression also poses a high risk for children to get ODD. So let's think about this. I'm a court-appointed special advocate for foster kids here in Hudson County, and I have seen cases where the role of the family, of course, is very, very important. So a child who is in one family might show very little signs of ODD, and then when they move to a different family, the symptoms become more and more severe. I've also seen cases where we were talking about before, mild versus severe. So the child might be fine in school and acting out at home or vice versa. So those are some of the experiences that I have seen in my role as a volunteer. So how does ODD affect the child's family life? A child with ODD could be displaying antisocial behavior. They could show impulse control problems. And they could be at risk for substance use disorder. And they could also be shown some suicidal intentions. So if you are a parent with a child that has been diagnosed with ODD, what should you be doing? What you want to do is you want to be a good role model. You want to praise and criticize the child's behavior, but not the child. And you want to use rewards over punishments. That is the strategy that has been found to be most effective with children with ODD. So let's move from the home to the school environment. To illustrate this, I found a video made by Defiant 2206 that shows you some of the issues that you can see in the classroom. So what does oppositional defiant disorder actually look like in the classroom? You can see excessive arguing, refusal to comply with rules. Please take out your book. No, I don't want to do it. That's one way. That's one of the signs. The questioning rules. Please go to the office and get into dress code. Why can I wear leggings? You let Gina wear them yesterday. They could be deliberately annoying other students. Can you please stop singing? We're going on a trip in your favorite rocket ship. That could be pretty annoying. Verbal aggression, hateful language, especially when upset. You're whack. Or bleepity bleep bleep bleep. That's could be another sign. Blaming other for mistakes, such as, okay, there's a fire started and nobody wants to take responsibility. It was Amy, it was Jim. Or being touchy. Lack of warmth from the parents could actually manifest in ODD, where the kids are more touchy than other children in the classroom, which is obviously not a good thing. So what are some of the signs a teacher should be watching out for? So you can start looking at if the child is angry and resentful. Does the student defy other adults? Does the student often lose temper? Is the student spiteful or vindictive? And is he or she easily annoyed by others or touchy? Schoolwork. Is the student struggling with the schoolwork? Are there any other displays of antisocial behavior? And does the student struggle with impulse control? Or does he or she fail to take responsibility for their actions? So let's just do a quick recap here. So how does the learning disability affect the child in the classroom? We saw some of these signs in the animation, but let's just go through them real quick. So a student with ODD may be refusing to comply with the current rules and instructions. They could be refusing to do assignments. They could be annoying, arguing, or fighting with other students and staff. They could be exhibiting unusual reactions, even to praise. They could be blaming others for failure of completing or procrastinating their schoolwork. They could pretend not to hear or understand instructions. And they could be failing to take responsibility for their actions. And they could also be testing limits, using bad language, and be throwing tantrums. So let's take a look here. What are the child's personal and classroom needs due to this learning disability? They would be looking for attention, and they would need attention from their teachers. They need unemotional teachers, teachers who do not react emotionally, because that will just further the disability. If you have a teacher that gets emotional, they thrive on that. So you want to have a teacher that is unemotional. They need consistent instructions. And they need clear rules. As a teacher, you want to have clear rules for kids with ODD. And they actually do need to learn social skills, so that they're going to need a greater emphasis on learning social skills. So now that we have looked at some of the signs and symptoms and identifiers of ODD, let's check in with a real-life teacher. I sat down with Brad Silvestri, and he is teaching 6th grade right now, and he has been teaching for 13 years. So let's see how he handles it in the classroom.
So in my experience dealing with kids with oppositional defiant disorder, I've realized that you're basically taking 5 steps back if you're trying to be confrontational with the kid. It's not going to work. You're basically doing more harm than good. So what I've learned is to always give the kid an opportunity to have his space or her space, never to be confrontational, give them opportunities to have frequent breaks, whether it be to maybe go run an errand for you, or maybe take a walk with a reliable student, or maybe a teacher's aide. Always provide them with something like a short-term goal. Like, for instance, all right, I understand that you're not really feeling the work that we're doing right now. How about if you give me 10 minutes of work, I'll let you, go on a website or something like that on the computer for 10 minutes. So just always continually giving them some positive reinforcement and a goal and an incentive.
So let's just do a quick recap of some of the methods that Mr. Silvestri was talking about, some quick do's and don'ts for accommodating students with ODD in the classroom. So you should be choosing your instruction carefully. You should make sure that you provide structure and discipline and that you follow through. Make sure you use positive reinforcement. Avoid a power struggle. Be calm and listen to the student. Some of the things you should not be doing is threatening the student, respond emotionally, convince or bargain with the student, and deal with student in front of the peers. That's something you should not be doing, because that could cause a reaction. And also, don't put down the student. That's a terrible idea. So let's take a look. How will these needs affect other students in the classroom? They could be disrupting the learning environment with outbursts. They could be demanding the teacher's attention, leaving less time for other students. And they could be bullying and teasing their classmates. So how will the learning disability be accommodated in the child's future career choice? And what transition service might be necessary for this child with ODD? So oppositional defiant disorder is primarily a childhood disorder. It's not really diagnosed in adults that often. So as far as transitional service and what to recommend for a career choice, you want to make sure that the child has outgrown these tendencies and have gotten help. You would want to recommend a job where there's clear rules, basically using the same strategies as you would do in a classroom. But as I said, there aren't that much need for it because this is primarily a childhood disorder. And that about wraps it up for me. Thank you so much for listening. I've enjoyed this presentation and I hope you have too. Bye-bye.